In India, especially, there is a lot of stigma attached, revealing about your mental health. And also, people are not even aware of the basic difference between mental health and mental illness.
When an illness sets, there are triggers many times. Triggers can be anything. Even day-to-day routine events can be stressful for some people. There is a difficulty in managing a routine. That is the sign that something is beyond a certain limit or a level. And it is kind of crossing over into an illness pattern. We are a population of 8 billion on planet Earth, and 1 billion have got psychiatric illnesses. No doctor has become a doctor by reading things on Google.
I have anxiety, I am stressed, I'm depressed. Do you think these words are being very commonly replaced by simpler terms such as I'm sad or I'm upset? What is your take on this? What is the bare minimum trigger or a symptom of a clinical depression? Often not spoken about, something known as postpartum depression. There are a lot of women who are, new mothers are going through it, probably dealing it, by themselves because somewhere even the family fails to understand. How would you address this problem? Hello and welcome to Bona-Fide Banter with Zalak Mehta. Today's conversation is very close to my heart because we are diving into a subject that touches all of us, mental health. In India, we've come a long way in talking about physical health, but mental health is still often whispered about, hidden, or brushed aside. To break that stigma and bring clarity, I couldn't have asked for a better guest. Joining me today is Dr. Malay Dave, a highly respected psychiatrist based in Mumbai with over 25 years of experience helping people of all ages, from children struggling with attention and anxiety to women facing postpartum or menopausal challenges to senior citizens dealing with loneliness or dementia. In this episode, we'll talk about the real signs families often miss, the rise of mobile and gaming addiction in today's youth, the difference between mental health and mental illness, and even how self-diagnosis through Google or AI can sometimes do more harm than good. So without further ado, we welcome Dr. Malay Dave on our show today. Thank you so much for joining us today.
Thank you. Good morning.
Good morning. So you've been in this profession, you're a psychiatrist since the past, I think, over 25 years.
Yes.
I always had this question. What is the basic difference between a psychiatrist and a psychologist?
The basic difference is, in very simple terms, medical versus non-medical.
Okay.
So, psychiatry is a medical branch. It's a postgraduate specialty.
Okay.
Which includes a minimum 3 years of training after basic MBBS. Psychology, on the other hand, is a graduation in arts and a post-graduation in arts with psychology subjects.
Okay.
So, so the basic point is that as psychiatrists, we focus on mental illnesses, we diagnose them, we treat them over a period of time. The work of psychologists would include psychological testing, different forms of counseling and therapies.
Okay. So yours is a medical
Yes,
field.
it's a medical branch.
All right. Doctor, I have heard, and we, in India especially, there is a lot of stigma attached to, revealing about your mental health. And also, people are not even aware of the basic difference between mental health and mental illness.
Yes.
So I would want you to explain more on this.
So when we define health, we look at an absence of any illness.
Right.
So when there is no illness, it is a state of health. Whenever there is an illness, the state of health is kind of in a state of imbalance or disrupted. We treat the illness and we get the individual back to that state of health. Now, what happens is that when we come to the area of psychiatry and psychiatric illnesses, what we mean by mental health is that a person is comfortable, a person is able to manage his or her routine, his or her work, his or her relationships without much of an effort and without much of difficulty. That is a state of health. Now, illnesses are completely different in the sense we have different kinds of psychiatric illnesses, and these are things which will cause a lot of difficulty and impairment to an individual, maybe over a short period of time or a long period of time, sometimes lifetime, and they will need to be addressed medically like any other illness. So that is the basic difference between health and illness.
Okay.
To simplify it a bit more, all of us are faced with day-to-day challenges.
Right.
Uh, in whatever field we are, in whatever we are doing, we may be students, we may be going to school or colleges, we may be working, we may be homemakers, but we have got challenges on a daily basis.
Correct. Yes.
And what happens is when we interact with these challenges, with these issues or these difficulties, we experience changes within ourselves in terms of we may feel okay, we may not feel okay, we may feel angry, we may think a bit more about certain things, we would not like to say certain things, we may quarrel with our friends, partners or anybody, we may be upset. Now these things are normal for everybody.
Okay.
What may affect me may not affect you,
Right.
or may affect somebody in a slightly different way.
Right.
But we keep on dealing with these issues, and once we kind of deal with these issues, we feel okay, we think right. Now these issues will happen, and they will cause certain ripples or fluctuations in our daily mood states.
Correct.
These are not illnesses. These are normal things, these are normal phenomena, and all of us will continue to experience this throughout our lifetimes. Illnesses, on the other hand, are, as I mentioned before, they are significant variation in all these kinds of things. They will need to be addressed differently, they will need to be understood differently.
Right.
So what happens is that when an illness sets, there are triggers many times.
Like?
Triggers can be anything.
Okay.
There is no specific
Any
trigger.
general triggers?
Anything. Even day-to-day routine events can be stressful for some people.
Okay.
So whenever there is a trigger, and oftentimes there is no trigger,
Okay.
because these illnesses, they are not actually dependent on external stress factors all the time. They may act as triggers at most, but then an illness is a self-sustaining entity.
Right.
And that is why we need to treat them. That is why we need to treat them. So what would happen is that if I am upset over something, it might take me some time to get back to normalcy.
Right.
But if this upset continues on, and then there seems to be no time relation,
Right.
means the temporal connectivity between what has happened and what is going on becomes of minimum significance. And this difficulties, they continue going on even when there are no situations or no difficulties, and that is what is an illness.
Okay.
So the distinction between illness and health would be something like this, that situations will happen. All of us will need to face our situations, our difficulties to the best of our ability. We may be successful, not successful. We may be upset, not upset.
Correct.
It's all a part of normal human behavior. And we would not term this as an illness.
Right.
But anything which has no kind of a strong connection, okay, there is a trigger, but then what happens after the trigger is completely disproportionate to what the problem was. Even when there is, many times this kind of problems get solved automatically or with somebody's help or advice, still the difficulty remains, and that is best to be viewed as an illness, and professional help needs to be taken for that.
What is the minimum duration, that if something like this continues over a period of time, how would you define that period of time?
So when we technically look at diagnostic criteria, the basis on the basis of which we would diagnose illnesses is, let's say, a minimum of 2 weeks.
2 weeks?
Yes, minimum of 2 weeks of a person experiencing difficulties would be it would be advisable for him or her to seek professional help.
So basically, lack of sleep.
So what I would look at is sleep issues, eh, less sleep or more sleep than normal. Appetite, a person doesn't feel hungry so much or eats more. So sleep changes, appetite changes. Problems with attending to your routine. So routine is a big thing, but everybody has a routine. Children will have a routine of going to school,
Correct.
their extracurricular activities. Somebody who's attending college will have their studies, their classes. Professionals, they have a routine of their work.
Right.
Even homemakers, they have their routine. So when there is a problem in managing this thing, now why we call it routine is because this everybody does without a second thought.
Right. That I have to do this. I have
Yes.
to follow my
So we have our
Yeah.
routines.
Correct.
But when there is a difficulty in managing a routine, that is the sign that something is beyond a certain limit or a level,
Correct.
and it is kind of crossing over into an illness pattern.
Okay.
So we have sleep disturbances, we have appetite disturbances, we have disturbances in managing one's routine, and the fourth point is the relationships.
Okay. How does it affect that?
So when there are difficulties, a person is not going to behave as normal as he or she was before. So there are going to be a person can become snappy or irritable, withdrawn, and this is going to have an effect on all his or her relationships everywhere, whether it is at home, whether it is at work.
Right.
So the general term that people who are in the vicinity or in the surrounding of this individual would say that this person is now kind of different from what he or she was before. So when these four things are there, now irrespective of a diagnosis, because in any psychiatric illness or in with any psychiatric diagnosis, something or the other of this is going to be affected. Now, when this is happening, okay, if it is happening for a day, I might not be really worried about it. But if we look at a period, as I mentioned, about 2 weeks, means, well, it is going on and on. And these are definite indicators that something is not okay.
Okay.
And better
So
taken
what's
away.
the first thing that person should actually do? Go for a therapy, a counseling, to a general physician, or to a psychiatrist?
So what happens is this, that the intake or how a person enters a system is different at different places.
Right.
Now, in India, we have kind of open access doctors. So what anybody needs to do is maybe contact a doctor, get an appointment, and in places in the Western world, they have a system wherein they will need to meet up with their family physician or a primary physician who would assess and then decide if there is a need, and then refer higher up. So
Right.
to a psychiatrist or a specialist, depending on the nature of the problem. But since we are in India and talking about India, most people would go to their family physicians because that is the easiest and the most accessible point. And then how the family physician understands the nature of the problem, then they refer. And of course, there is something in terms of word of mouth. I have treated somebody, and now they find that somebody in their circle, whether it is family, friends, relatives, seems to have a similar problem. Then everything is bypassed and the person comes to me directly. But if any of these few things that we mentioned is happening, going on, then definitely the first point of contact would be a medical professional.
But
Everybody
like
would
a
not.
psychiatrist directly?
Ideally,
Okay.
ideally. But what will happen is people may not understand what is happening. So a family physician, a primary physician, means whosoever has been treating the family for various illnesses, that becomes the primary contact.
Okay.
But when something like this is happening and whenever there is a facility available, Every place is Mumbai is a metro city. So we have got lots of psychiatrists in the city, but if you go to a smaller place or a smaller
Right.
district, there may be there would be a shortage. So if a psychiatrist is available, this kind of things are happening. Definitely, the first thing to be done.
Okay. And what do you think about the stigma attached, to it, that, oh my God, people will think I'm mad. Why am I going to a psychiatrist? I am absolutely normal.
Yes.
The acceptance is
Yes.
still
So
taking time.
so what happens is this. But let me tell you one thing before I get into that. The type and the kind of stigma that was there 25 years back when I started my practice,
Yeah.
not that all of it is gone. Stigma is definitely there. And then there are different shades to that stigma. So why does the stigma come? First of all, when we are dealing with mental illness, we are dealing with things like a person's emotions,
Yeah.
behaviors, thoughts, memories. Now, anything going wrong in this would mean that the basic identity of that individual, the basic understanding of that person as himself, the integrity of oneself, these kind of things will get affected. So how can this go wrong? Okay. Now, when people have fever or people have a heart problem, it is easy to think of fever as an infection, heart problem as affecting a certain part of the body. But when we are talking of the person as a whole, who is me, who is you, who is she, that integrated or the complete persona or existence. Now, when that gets affected, it becomes very difficult to separate oneself from the illness
Of course.
for people. Now, as psychiatrists, we understand what is happening, but for people, it will be very difficult to why I was like this, but why it is happening like this.
Yeah.
First is that. Second thing is people sometimes these issues that affect an individual are mistaken for an illness,
Like?
and so vice versa. The thing that we talked about, things are affecting me. I'm
Okay,
there is a
those
certain
kind of
situation
issues. Yeah.
that all those things that happen to us. So the other way can also happen. That because I have got a lot of work, this is happening. So let me do something. It may be a separate illness altogether and nothing to do with. But the understanding is that this is just okay and it will go away. So nothing
Yeah.
needs to be done. Another thing is that people have just a unitary understanding of mental illness as madness, pagalpan.
That is major, I feel.
Yeah. But that is actually a very small proportion of severe illnesses that we look at. And those according to me are terms which should not be used.
Exactly.
We have got certain names for it, and we have got names for it because we can treat the illnesses.
So well said.
And when we treat the illnesses, they get better. So nobody remains in that state forever.
Correct. Yeah.
So stereotypes, it's always difficult to beat a stereotype anywhere. People feel that once they have an illness, what will people think about it?
Yeah.
Because everybody seems to have an idea of what is normalcy and what is necessary, and everybody is very well aware of social norms when most people aren't actually. So this kind of things create a stigma. What also kind of adds to the problem, which has been happening of late, is what people read in terms of newspapers, or what people consume in the form of what is available on Google, internet. They are like anybody can put anything. So
Yeah. Social media.
So anything. Social media is just it's a different version of the internet. So people put in their thoughts. It is
Right.
nice to put your thoughts, but it doesn't mean that your thinking process is right or what you are saying, putting is correct.
Absolutely.
And everybody has an access to that. So there are a lot of things which people may not understand and they would put it, and then that kind of becomes the narrative which people would like to follow. So that adds to the stigma. Another thing is what is commonly said is that when a person is not well, he or she lacks the willpower to not remain okay. Once he or she becomes more confident and has willpower, then all these things will be okay. That willpower business comes from a lot of things that we learn over the years, that you have to succeed, you have to control yourself, you have to manage yourself in whatever situation. So it is a kind of measure for everybody that this should be it.
Exactly.
So when that doesn't happen, then people feel that, so, okay, I'm lacking willpower or motivation, then let me read something on motivation and self-help and all that.
Yeah.
So, but not go to a doctor and figure out that it is an illness that can be treated. So
self-diagnosis.
yeah. So I tell people one thing: if there is a patient in front of me or somebody whom I'm talking to, or in a talk like this, is the best way to remove stigma is if you have a problem, go to a psychiatrist. If somebody you know has a problem, go to a psychiatrist. See how treatment works. Because there have been in the history of medicine so many illnesses that maybe even 100 years back were stigmatized.
Correct.
We had smallpox, which had stigma. We had tuberculosis, which had stigma. We had leprosy, which had stigma. We had HIV, which had stigma. And now all of them are smallpox is eradicated from the face of the earth because we understood that it's an illness. We have a vaccine. And now nobody gives a vaccine also because it is gone. We have leprosy, which has got very good antibiotics. We have tuberculosis. Now there is no stigma about tuberculosis. In fact, in the developing world and maybe elsewhere, disorders like tuberculosis have become more problematic, more severe, more resistant to treatment. There is no stigma because treatment is available. People understand that it's an infection, take the treatment. It's a long treatment, get better. So no stigma. So when people deal with this idea that, oh, this part of me cannot be problematic, this cannot go wrong, okay, this is untreatable, I have got a label for life. People add to that, no, this is, you are suffering from a curse or this thing, that thing. All this leads to stigma. When the issue is simple, when people understand that there is something called as an illness, and again, this stigma is not there only in our country. The stigma is there in different forms all across the world.
Okay.
Even in developed countries, the stigma will manifest in different forms.
Okay.
In different, in a different kind. So the best thing is treat. Now, I mean, it is not for nothing that when WHO compiles, the World Health Organization compiles a list of major illnesses that affect people. Okay, there
Which
must
are
be
in the top?
So if we have the top 10, we will have depression,
Okay.
we will have addictions, we will have dementia as common illnesses in the top 10 list. Then there will be, of course, heart disease, blood pressure, diabetes.
So mental
strokes.
illnesses have always been on top 10.
They have always been there. Now when people have started compiling lists, then they understand that they are kind of quite high on the list.
Okay.
And just a few days back there was an article, where did I read it, in the paper or whatever, on Google, that we are a population of 8 billion on planet Earth, and 1 billion have got psychiatric illnesses.
Oh my God.
So that is 12.5% of the population of the Earth. Now, it is not one illness, there are different types, but we have a huge number of people who are suffering from mental illnesses.
And there must be so many who may not be probably aware of it.
Yes. So that is the whole point.
Yeah.
That these are very common things, because if we have got 1 billion out of 8 billion, means 1 in 8 person has got something.
So true.
And when there is stigma, this 1 in 8 is actually not going to go for help, get treated. So in this 1 billion, there'll be so many millions who either have no access, who have no information, and they don't get treated.
Right.
So this is the state of affairs.
Oh my God.
Another thing is that psychiatric illnesses are present everywhere on earth. So we coming back to that 1 billion out of 8. This population of 1 billion people who are suffering from various psychiatric illnesses is present throughout the world. There is no
Absolutely,
culture,
yes.
there is no society, there is no country, there is no city which is free of mental illness.
True.
Now, what happens is that the illnesses are similar. The illnesses are similar everywhere in each and every population, whether the person is from a city, a town, a village, a tribe. They all have similar problems, only in different settings. By settings,
Right.
I mean where the person resides, in a metro, in a tier 2, in a village, in a small village where there are 10 households. So, different cultures, different religions, people have psychiatric illnesses, full stop. What these different settings offer is maybe slight different kind of presentations.
Like?
Like if I am in a city, what will happen is the presentation of an illness, let's say for anxiety, people may mention that I've got a lot of work, I've got a lot of stress. The same person in a village or a smaller place will say this is because of God's curse. Now the thing doesn't differ. The illness doesn't differ. Only we have rice preparations everywhere in India.
Of course, yeah.
North, south, east, west, central India, each and every state has their own rice preparation. Rice remains rice. But what gets added, what kind of a curry, what kind of a seasoning, what kind of meat or vegetables get added, we have a different name. Essentially, it's rice.
Right.
If there was no rice, all these things would have no meaning.
True.
So, illnesses are like that. The basic illness remains the same. All these components, cultural components, societal components, will add some kind of a different flavor and attributions. And the ease by which a person will approach a professional. So now what happens in a metro city, people may be more aware. I'm saying maybe because I know people who should be aware and are not aware of psychiatric
Correct, yeah.
illnesses, who have their own set of stigma. Facilities are available, doctors are accessible, so many allied professionals are available, so the access is easy.
Right.
That kind of access is not there as we go down the level of population.
True.
And there are many districts in India who may, in the whole district, there may be one or two psychiatrists. So, access, the ease with which people would approach a doctor, all those things will vary, but illnesses remain. All kinds of illnesses are there everywhere on earth.
One just needs to be aware of themselves as to what is happening and just go out there and consult.
Yeah. So
Do not self-diagnose.
Yes, self-diagnosis is always problematic because, again, I tell my patients or people whom I interact with is, see, no doctor has become a doctor by reading things on Google.
Do you get patients who come for,
they come to
Google
me that I have
search?
read this on Google and this says that.
Yeah.
So there are two things. One is Google gives information, which is fine. Google gives all the information which may not be fine because you may not understand what is important and relevant to you
Correct.
and what may not be relevant to you. Third thing is information is fine. It may be relevant to you, but you are in no position to understand how should it apply to you.
So true. And now even now in the era of AI, you know, people directly they treat it like their personal counselor. You know, so and so is happening to me, and then AI will give them a solution. What do you think about
So
this?
no, that's what I'm saying. That when let me put it this way, science is evolving.
Yeah.
It will continue to evolve because we don't know everything about everything.
Of course.
So does medical science. Medical science deals with human beings. So the level of complexity in understanding medical science is much different from other sciences. Now, point is that we continue to understand more, we continue to accumulate knowledge more, and we continue to refine existing treatments, and we continue to develop new treatments. So at any point in time, the knowledge is evolving, and it should not be considered as this is it.
Correct.
This is it. That doesn't happen. Things will change. Now, what happens is everything is there on Google.
Yeah.
The level of knowledge what we have now is there, and there'll be what are the future predictions, projections, future research. Everything is there. Now, people may not understand the difference between these things. They feel that Google says this, so this is it, this should be the treatment, and this should be the outcome. For human beings, the outcomes are very, very variable. There is no one size fit treatment for the same problem in different people.
Correct. But there also may be a situation, doctor, where, you know, if, for example, a person is experiencing the symptoms, like you mentioned earlier, but at a point, probably he or she feels that nobody in my family is going to understand. I cannot, and of course, if that person is again financially not, independent, if he or she goes to a psychiatrist, how will he pay for the treatment? And then they start self-diagnosing. Now, over here, what I want you to address the viewers is that the families, you know, how they should deal with a person who is depressed, or how they can find out that, you know, there are some changes happening in his or her body, mental health, and there is a way that they should react.
So, two things. One is that changes that are happening.
Yeah.
We talked about those basic changes
Basic, yes.
which
yes.
are going on and on that
Right.
that anybody can pick up. That anybody can pick up. Forget family members. Even the maid who comes to your house will be able to pick it up.
So family
So,
ko to
so,
pata
so
hona hi
everybody
chahiye.
will
Yeah.
know that something is not
Something
okay.
is
People
up,
will not
yeah.
know exactly this is wrong or that is wrong, but people will know that something is not okay.
Exactly.
That is one. Now, how do people deal with it? People deal with it in different ways. People say, okay, ठीक है, time दे दो, ठीक हो जाएगा. Wait, watch. In waiting and watching, nothing actually happens.
It gets worse, right?
Nothing changes. It just goes on and on. But that's besides the point. So one strategy is wait and watch. Second strategy is people start giving words of wisdom.
Yeah,
Think positive.
exactly.
Motivate yourself. Go to the gym. Do yoga. Now, this becomes problematic because this is basically what the person doesn't feel like doing. So that doesn't work. So second thing is giving advice. Third thing is it also depends on family dynamics. Family is a group of individuals. Now, if they gel well, if they understand each other well, so when they pick these things up, okay, they would be rational about how to go about it, not just give advice and leave it there.
Exactly. Yeah.
The difference between giving advice and treatment is, in advice it is direct, do this, don't do this. In treatment, if you need to do this, how you are going to manage that? What are the best approaches? What is the best treatment that can get you well? So it's an advice, but it is properly personalized,
Exactly.
customized, and if there are contingencies, they are managed in terms of side effects of medications or something like that. So first of all, everybody may not have the same level of understanding of what is happening. Now, in an ideal situation, when somebody picks up, when the family members feel that something is not okay, then the first thing that should do is, well, let us seek help.
Exactly.
Because what is important to understand is that when somebody becomes ill, it is nobody's fault.
Absolutely.
So the way you are going to behave with somebody in your family who is not well need not necessarily change, except that you become a little bit more understanding. Because if how I am going to deal with somebody is going to make a difference to that person, and the person is going to become better, then you don't need any help. Then it is not an illness. So many people come up with this question: how do we deal with our family member, A, B, C, D, brother, sister, father, mother, child, when something like this? My answer is, well, the only thing you need to do is be patient, because it is going to take time for this person to get well. Be understanding, and what do you need to understand? That what is happening right now is because of the person's illness. The person doesn't want to deliberately do something.
Absolutely. Yeah.
So you need to remove that thing that he or she is doing it deliberately
Right.
and react to each and everything.
You should not react. Be patient.
Be patient. Get out of, try and not, I mean, if a person is having difficult behaviors, I can get irritated with that person, but leave it to that irritation. Don't escalate it further. You know. So the best way to deal is one, proactive action.
Understood. I have anxiety. I am stressed. I'm depressed. Do you think these words are being very commonly replaced by, by simpler terms such as I'm sad or I'm upset? What is your take on this?
See, all the terms that you just mentioned, they are there in the English dictionary.
Right.
But when it comes to the field of psychiatry, they have got a different meaning. When we use them as English words, we are looking at mental health. When we look at these words from a psychiatric perspective, we are looking at mental illness. So I can be upset about something. I can be sad about something. I can be angry over something. All these things happen on a daily basis.
And they are common, right?
So this whole gamut of emotions, or what we experience, or what we think, is there in each and every human being.
Correct.
How we express may be different for different people, but all of us do experience these things. Now, illnesses are abnormal forms of this. Unfortunately, we do not have different words. I'll give you an example that I have got, let's say, an exam coming up after 15 days. Now I am going to be anxious.
Yeah.
What will happen, whether I'll be able to finish my revision, and so on and so forth. Now, what is the general experience of people who have this kind of anxiety is the moment they start writing their paper, it just vanishes.
Okay.
For most people, the anxiety is there. It's a kind of a build-up. And once you give the exam, it just goes away.
Okay.
You may be good, you may be average, you may not be, you may be below average, but whatever, once it is there, then it goes away.
It's just like a tension.
So this anxiety is a normal experience. But if you look back to what we discussed about illnesses, this goes on and on. Exam, no exam, exam over, results aa gaya, but still anxiety is there. That is an illness. Because quality-wise and quantity-wise, so qualitatively and quantitatively, it is much different from what that normal experience of anxiety is. But the label is anxiety. Because we do not have technical words, we do not use technical words to differentiate this thing. So then for people it is interchangeable. The word is there, but the context and the meaning as we understand as psychiatrists is different.
Right.
So when somebody comes and says, I have got anxiety, okay, I don't prescribe anything, but let me understand what you mean by that.
Right.
What is your experience? How it started? How is it going? What are the changes? What are the fluctuations? And so on and so forth. The same thing with sadness. We are allowed to feel sad on a normal basis.
Exactly.
But the sadness that comes in depression clinically is again quantitatively and qualitatively different.
What is the bare minimum, trigger or a symptom of a clinical depression?
Trigger can be anything. So
Okay.
it just is variable. So there is no one trigger. It is also not necessary to have a trigger.
Okay.
It is not necessary to have an identifiable trigger. So what can happen is that what may be normal for you or for anybody can trigger something in me. Now 99% of the population will say that what you are talking about in terms of trigger is okay with them. Well, but the same trigger affected me. So when we are diagnosing and when we are treating, we ask about triggers, but it is not always possible to avoid a trigger. And because it is an illness, it is not that important. We have to treat the illness, not the trigger. Because as I said, triggers are variable. So if there are 10 people in this room, there will be 10,000 triggers. So imagine that if we live in a city of 10 crore people or 1 crore people, what is the number of triggers? So triggers can just kickstart a process. That process is in place, only it gives a kick starts, accelerates, and we are looking at symptoms. So bare minimum, it can be nothing also.
Okay.
It can be nothing also. It means there is nothing in the person's environment which has triggered.
Okay.
Even some challenges in a person's daily routine, some changes can trigger.
Okay.
I'll give you an example.
Yeah.
I am currently seeing a patient
Okay.
who is actually a very old patient of mine. And I am treating her for depression. So she came to me about 3-4 years back telling me that I am feeling sad all the time. I feel like crying all the time. I do not feel like doing any work at home. I'm not sleeping well. I've lost weight because I'm not eating. She's right now in mid 40s. So when she came early 40s, I'm having irregular periods. So that was the kind of a thing. Sometimes I get thoughts like I don't want to live anymore. Okay. At that time, when she came to me first time, what was the trigger? I don't know. I'm not able to, everything is fine. There is no stress in the house. Husband is okay. Children are fine. We do not have any financial issues, ABCD. So no obvious trigger.
Okay.
With treatment, she did fine. Now, 2-3 years down the line, she has come back to me again
Okay.
with the same thing.
Okay.
What is the trigger this time? She's telling me that 3-4 months back, we shifted to a new, bigger house. Nice, big society. This is what I wanted, but I'm depressed.
Oh.
Now, will you call that a trigger or not a trigger? For 99.9% of the population, moving into a bigger house, your own place, is good. It is a sign of prosperity. It is a sign of progress. It is a sign that, this is what you wanted all your life has happened. It is a trigger for her. So triggers are okay, but triggers are not necessary. So more important is what is happening to this individual in depression in terms of they present with symptoms, but there are a lot of things that are happening inside the body and the brain. That is the focus of a psychiatrist to treat.
You mentioned that the patient that you're speaking about is in early or late 40s, right? Has menopause to do anything with this?
Menopause is basically a change in the physiological functioning in the life of a woman.
But I've heard a lot of cases internally in the family that, during that particular period, they get a lot of suicidal thoughts.
So it is like this, that what does menopause mean? That at a certain point in her life, a woman will stop having her menstruation, her periods,
Right.
and that is called as menopause. Now, that is an observable phase, but there are a lot of endocrine or hormonal changes in the body that have happened that will happen at that time.
Right.
The normal hormonal cycles which lead to the periods are now not there. The levels of hormones that were there are not there now. So each and every woman is going to experience this phase.
Right.
Now, for most women, it is of no consequence. Means it is a part of life, happens, the periods stop, and that's it. They do not experience any significant difficulty or change.
Okay.
For most women. There will be some women who will have some minor issues, meaning their periods don't stop, but they'll be irregular for a period of time. Sometimes there is a variation in the amount of bleeding. So this process is prolonged. That is the difficulty they have.
Okay.
And a small percentage of women will have, because there are hormonal changes happening inside the body, because a person is vulnerable, they can not only have depression, but they can have a lot of other things also.
Like?
The commonest one being depression, of course. Then there is anxiety.
Okay.
Other mood disorders can come up, because there is a certain amount of certain level of hormones necessary in the body for optimal brain function. Now when that level comes down, and if the person is susceptible, now when this thing happens, okay, then a person can actually develop a mental illness like depression.
Okay.
So it is not the rule.
Yeah.
Some women will.
And how do they deal with it?
They don't have to deal with
How
it. They have
should
to,
they?
they should not deal with it. If they are experiencing any of these, okay. First of all, if it's a normal thing, you should not worry that why nothing
Yeah.
happened to me.
Yeah, absolutely.
So that is all fine. If there are all these mood-related changes, we go back to that sleep, appetite, and all this
Yeah,
kind
yeah.
of a change, then definitely take help.
Seek help.
It is not only a question of in the basic genesis of the problem, hormones is one thing. But as I said, it will only work when a person is susceptible from the beginning to develop a mental illness. So when both these things match, then a problem will happen. So menopause is going to happen. It is associated with the development of an illness. So the focus should be on how to get that illness treated. So there is no dealing.
There's no.
You have to understand what is the problem and
Get help.
take necessary action.
Also, often not spoken about something known as postpartum depression. So a lot of women who are, new mothers are going through it, probably dealing it, by themselves, because somewhere even the family fails to understand. How would you address this problem?
So postpartum means the period immediately following delivery of a child. Now, in the postpartum period, so let's say immediately after childbirth to the next couple of months, many women, again, there is a variable kind of a course. Many women have no problem at all.
Okay.
In fact, most will not have a problem. Some of them experience what is called as postpartum blues.
Okay.
Means they feel a little bit low. They feel anxious. They feel that they may not be able to raise a child or be a good mother,
Like a self-doubt.
like a self-doubt. Now, this kind of a thing seems to be self-remitting, means it goes on for a while. Now, that doesn't cause so much of an impairment to that person. The person is able to manage
Okay.
with little difficulty and it goes off. This happens in some people. It's a milder form of, let's say, depression.
Okay.
Mild.
Mild.
And some women, they experience a severe form of this. And this, in postpartum depression, they experience severe depression. They experience a lot of negative thoughts. They often get thoughts of harming their child.
Oh my God, to that extent.
Yes. So it becomes a very severe kind of a problem. That definitely needs treatment.
Correct.
But any kind of a change in a person's, again we go back to that not sleeping, not eating, not managing. With a new child, the routine is always actually gone for a toss. So
Exactly.
routine, not a big difficulty. But how this person is handling everything becomes important at that time. Once a lady gets, let's say a lady has delivered and this is the time that she has goes postpartum, the chances of repeat, meaning the next time she gets pregnant, the chances of developing something similar is very high,
Okay.
because this is the same individual,
Yes.
the same kind of challenges.
Yes.
And what are the challenges? Again, hormonal changes in body metabolism,
Right.
right? Now, this is a pattern that gets set. So next pregnancy, something happens, the chances are high. Another thing is that there will be women who have in their past experienced some episode of depression or some psychiatric illness. This actually makes the lady woman more vulnerable.
That
So
makes me...
so after pregnancy, this kind of patients will be not only at an increased risk for postpartum psychosis or postpartum depression, but more severe forms also.
Okay.
When symptoms are milder, like the blues, people will say, okay, over time it will get better. It may get better, but the problem is that something has happened. And whenever anything happens to us, okay, there is always some kind of a change which remains.
Okay.
To give you a very simple example,
Yeah.
if I develop a viral fever, I get better, but the immunity remains. So next year, if I get a similar viral, it will not cause me a problem.
Right.
Means anything that happens has got a certain kind of a residual effect in the body. So when these changes happen, hormonal changes are there, and because of that the brain function is getting altered, this will remain. So this becomes a vulnerability. So if anything has happened, if it is not addressed, and if the woman doesn't get pregnant, okay, I'm happy with one child, still that vulnerability remains. This can actually manifest as an independent episode of depression later on in life.
God.
So, as you were saying that postpartum depression is actually there, it is a severe problem, but it is extremely unaddressed.
Exactly.
People should be aware of it, definitely,
And
because
should
it can
seek help,
because it is of course going to affect the mother, but it can also affect the well-being of the child
Absolutely.
in terms of proper care. Because if the mother is not okay, will not be able to look after the child.
Right. Right.
About postpartum psychosis or postpartum depression, we use these terms, but it can be a challenging problem. To give you another example on this,
Yeah.
recently saw a patient who came to me because she was very irritable. Means she would fly off in a rage at at minor things. Even if she's not angry, she's always in that chid kind of mood. She's not able to manage her household. She has got one child. The child is now about 3 years old.
Okay.
So she's not able to look after the child. She's not able to do her cooking and cleaning. She's a homemaker. She gets into frequent fights with her in-laws. This is the first child. And this problem has been going on. The child is 3 years. And this problem, what they're noticing is there since about a year and a half.
Okay.
The husband, the husband's parents, that is the lady's in-laws, and even the lady's parents, everybody is of the opinion that she was not like this. She was a very nice, loving person, very easygoing, managing everything. But now this change has happened since 1.5 years. So they are not able to put a finger on why this is happening.
Yeah. What triggered her?
Yeah. You talk of trigger. So there's no trigger. But this is happening. And it is actually increasing day by day. So that is now
Oh my God.
come to the point that, okay, we need to do something because she's not sleeping. And she gets so angry. Sometimes she hits the child also.
Oh God.
Child doesn't understand anything, 3 years old. So, the whole home environment is kind of not okay. So, first question, after, okay, what is happening is, what happened after you delivered? Because there is no past history. Everything is happening now in this few years. There doesn't seem to be any family history. So, there is contributing factors are not there actually. And no identifiable trigger. So then the lady says that immediately after delivery, for about 2 weeks or 3 weeks, I felt okay. But since then, I am feeling, I feel lack of confidence. I feel anxious without reason. I get thoughts like, what is the point of all these things? I'll not be able to look after my child. I've also got thoughts of ending my life sometime.
Oh my God.
Now this has been going on 2 to 3 weeks after delivery. Yet it was in a milder form. So she was able to manage. But then it has progressed. It has not gone away.
Build up.
So the question everybody is wise in hindsight, that what would have happened if somebody would really have looked into this
Back then.
a month after she had delivered? Maybe the whole thing would have been completely different. So this is what happens with postpartum, and there are n number of cases which will present like this.
Do you see now at at the current age, people addressing it more than before? Though I understand that it's not out there.
So I can just give you an example from my experience. Is that yes, now people, even when women after they've delivered, even when they experience some difficulties, they are open to talking about it.
That's how it should be.
Yes.
But this is about cities, doctor.
Yeah,
What
that's
about rurals? Where women are just expected.
Correct. So that's what. So what happens is, if the things are mild, people will somehow try to cope with whatever they have, with whatever difficulty they have, and if things are bad, then people will think, बहुत ही खराब हो गया तो लेके जाओ. Because when things are severe, it is going to affect everybody, not only the person who is.
Absolutely.
So then it will depend on the family members' level of understanding and.
So would you like to advise something about this to the family? That how they can figure out, how they can take care of it, how they can take
so the thing is that everybody who is in the family of a woman who has recently delivered, look for changes in the person's routine, how she's dealing with the newborn, how is her mood.
Is she taken care of?
So this basic things will give you pointers as to what is happening.
Wow, thank you so much, doctor. That was very well said. And I think very, very important to be out there. Also, speaking of women, you know, every time since she's a small girl to an adolescent to a woman, they are advised to just probably let go, deal with it, do not back answer, and whatever it is, ignore and don't take it to your heart. Do you think such terms eventually also affect their mental health?
Uh, I would like to put it this way that we are all expected to behave in a certain way in our culture, at large, in our society, in our family, on a smaller scale. So whether it is for a girl or it is for a boy.
Mostly for a girl, I believe.
So both ways. So there are certain set roles that
Right.
an individual has to play. Now, that is how the structure of society is.
Right.
One is that everybody doesn't function on the same level.
True.
So for some people, this societal norms may be okay. They're able to manage it. For others, it may be difficult. That is number one. Second thing is that when societal roles are this way, there are many things which will go unaddressed.
Yeah.
See, I have got a certain societal pressure, I have got some certain thing, I'm doing things, I'm okay till that time, no problem. But I have got some certain things chalked out for me. I'm not able to do it. Something else is happening. If that is not picked up and addressed, that is a bigger problem.
Yeah, especially something that's affecting you. You're
Yes.
not able to
so,
speak.
So what happens is the problem of this labels and things is
Yes.
that things that are important, are they getting addressed or no? Now, in
Yeah.
terms of this postpartum psychosis or postpartum depression that we talked of,
Yeah.
a woman's role is this.
True.
So what happens is, and it's there everywhere. So it is this,
Yeah.
and okay, fine, you have just delivered. So get back on your feet. You have got an additional responsibility now. Okay. So for most women who are on the normal track, this is okay.
Yeah.
They are able to manage. But for somebody who has a disorder, this can become problematic. And so there will be challenges
Yeah.
coming to deal with this because of the thing. Point is, the postpartum thing that is happening, the postpartum depression that is happening should not go unaddressed. So the bigger challenge is that there are expectations, there will always be expectations. Expectations will keep on changing. They'll keep on changing from this family to the next one. It is there. It has got certain protective value. When things are okay, things are manageable. When we give things a structure, things are better manageable. If there is no structure, things can, we will not be able to figure out what will be the next best approach. So till that point, it is fine.
Yeah.
But if important things like mental illness, like postpartum depression, okay, they are not picked up, then it can become problematic.
Exactly. Nowadays, after we spoke about women, now let's talk about kids these days. They are given screen time, phones, tabs at a very young age. What do you think about this? Will that impact a child's mind?
We understand what science tells us is that a growing child will try to experience, interact with, and master everything that is there in his or her environment.
Okay, right.
So when we were living in jungles, when we were not civilized, whatever was there in our environment, trees, animals, birds, fish, right?
Yeah. Yeah.
This was what they interacted with,
Correct.
experimented with,
Huh.
and mastered.
Yeah.
So when we became civilized, let's say in the last 100 years, what we have had homes, we have had schools, we have had some means of entertainment. 50 years back, only black and white TV,
Yeah.
then colored TV, then computers, then internet, now social media, right? So all these things are going to be there in a child's environment,
Right.
okay? And the natural development of the child is directed towards these three things:
Okay.
interact, experiment, and master. This is how learning takes place.
Right.
When we start anything, okay, you let's say somebody starts some professional course. The first thing is you have to kind of interact,
Yeah.
see what it is,
Correct.
talk to people, read your book, so you interact. Once you get certain idea, then you experiment, you create problems, you address problems depending on that. And once you have got results, then you will master that.
Correct.
So our school subjects, our education, our professional studies, whatever we do at home, at work, is this. So this is basic. So whatever is there in the child's environment, the child is going to play with.
Okay. So you think
So
it's okay?
so play is a general this thing, which is these three components:
Understood.
interact, experiment, and master.
Yeah.
Now, if something is there in the child's environment, this is going to happen. Now, whether it is happening in your home, at school, or at the child's friend's place, this is the same process. So, if we need the child to be productive is not the word. For the child to develop in a healthy manner, be good at what he or she does, okay, then the environment has to be a rich environment, which has got everything,
Okay.
including screens.
Including screen time. Okay.
But not only screens.
Yeah. Yeah.
The more stimulating an environment is, the more things that are there in the environment, more experiment, more interaction, more mastery, right?
Right. Right.
So screens are not a problem. Screens are going to be there. Screens are going to be there. First, there was one screen in one house. Then there were some more screens when they were desktops or laptops. And now the number of screens is equal to or more than the number of people in the house.
Absolutely. Yeah.
So screens are screens. What are the advantages of screens? See, everything that is there in the environment has got a plus and a minus,
True. Yes.
a positive and a negative.
Yes.
If we focus on the positive, we get a good outcome. If we only focus on the negatives, we may not understand what is actually happening, and we may kind of not have a very healthy way of looking at it. Now, what I mean is this: what is done on screens is important than the screens themselves and the time spent on screens.
Okay.
And third, what is the place of screens in the total environment of the child? Now, if we think screens are bad, okay, then after the podcast, nobody should be watching it on a screen. There is no place for that. But people are going to watch it. People can watch it on a laptop, on their phones, on their iPads, tablets, whatever.
Agreed. Adults have that
So
addiction.
yes, correct.
Yeah.
So when something is there in the environment, it has to be used properly.
Correct.
And for children, okay, how do children get introduced to things? By parents or at school
Yeah.
at a young age.
Correct.
When
Yes.
children are older, then they will kind of tinker by themselves. They'll try to figure out what is this book, what is that thing.
Yeah.
But otherwise, they are introduced to something.
Yes.
So the first introduction would be by a parent
Yes.
or a grandparent, right? So now the thing is, if I have a screen, if I have a mobile phone or an iPad for myself, and if I tell my child you're not supposed to use this is not going to work.
But there's a restriction on time limit,
Correct.
right?
So that is not going to work. It is the same thing like I smoke in front of my child and I tell my child smoking is bad for health. That doesn't work.
Right.
So what is important is this. If a child is introduced to something which they should be, they should be supervised.
Very important.
So what is important is,
Yeah.
as I mentioned, not the screen time. Screen time, okay. But the content is most important. Right? Content is most important. Second thing is time, but that is a variable thing. Many schools now have their classes on screen, their homeworks on tablets, and some books. So if a child is going to be in school and using the screen for, let's say, some hours, you cannot curtail that screen time. So when a child is introduced, then the most important thing is supervision. Supervision of both content and time. Because, as I mentioned, how stimulating overall the child's environment is.
According to you, should there be a certain time limit on a daily basis?
It is very variable. There are certain guidelines which would say that, for first couple of years, minimum screen time or no screen time. And after a couple of years, 2.5 years, some 1 hour per day. But all this will happen when everybody is on the same level of understanding. So if I'm working from home and I'm in front of a laptop or a tablet or a phone all the time, and I tell my child, no, bad for you,
Yeah.
may not work.
So the parents should also use
Yes.
less screen, right? In
Everybody is
order
going to use screens, but you have to use screens wisely.
wisely.
So if before going to bed I am always scrolling or whatever, looking at some videos or reading something, and I tell my child you should sleep at 9 p.m. No screen time, there is a problem. So my understanding and what I see is that one, screens are unavoidable at any age.
Right.
Secondly, screens should be a part, a necessary part of a child's environment. Because if you do not allow screens, okay, there are some people who will be very, I will not let my child use any kind of screen till the child is in so old. What happens after that? Second, if another child uses a screen, how are you going to prevent these children interacting?
Also, now a lot of tabs and screen are introduced in school
That's what I'm
itself.
saying.
Yeah.
So
correct.
everything is screen based.
Yeah.
So the bottom line is screens are going to be there. It is important that they are a part of the child's complete environment and not the only part of the child's.
Right. Right. Very well said.
So, and three, when screens are introduced, when tabs are introduced, then there should be supervision of content.
Correct. Yeah.
To give an example, when I was a child, we had black and white TV. So, and that was Doordarshan. So only some few hours of TV programs every evening. And some few programs in the daytime, which were more educational, related to schools and things like that. So the general kind of, so to say, request from parents was, don't watch too much of TV, you will get specs.
Oh, yeah.
So that was the first few years. Then we had a color TV. Then, so for many years it was only TV. Black and white TV, color TV, but with Doordarshan and national network. Then came cable TV. Then came the first desktop computer. And after many years came the laptop. after that came the mobile phone
Mobile.
for us.
Yeah.
But somebody who's born in 2000s, in the 21st century, they already have these things. They start with mobile phone.
True. Yeah.
So it is a part of everybody's life.
Can't be avoided.
Yes,
Yeah.
it is like saying, if it is like telling my generation that you should not watch TV. But we are born with TV.
True. Yeah.
So before there was mass printing, there were no books in each and every house. Now there are bookshelves everywhere.
Correct.
So it's like telling somebody that you should not read books.
Hmm.
So things are going to change. Newer things will come up in our environment. For children, when they're growing up, when they're developing, they should be a part of their entire environment. That is what is necessary.
True.
So what happens is, child is crying, parent says, okay, take the screen, don't cry, I'm busy. Now that may create a problem
Yeah. Even while eating.
for anything. So when the screen becomes a substitute caretaker, the child is going to expect the same thing as the child would from a human caretaker. Entertain me.
Right.
When parents are busy, we have a caretaker. So what is the caretaker supposed to do? See to it that the child is safe, not hungry. The child is small, not soiled or wet their pants, doesn't fall. Play with them. This is what is necessary. Now, the more you use a substitute for this, the child is going to expect the same.
Good point.
Okay.
Right.
Now, when I say that it should be a part of the child's environment, a child's environment also needs other children to interact and play with. I have grown up playing more in the ground than playing at home, but that was our environment. So another standing instruction was, don't play too much, you'll fall sick. So there are certain skills that will develop, the interpersonal skills that can develop
Right.
when there are children around.
Yeah. And doctor, what do you think about the young, kids getting addicted to mobile phones?
So, addiction is something that we don't use very lightly. But again, the point is, what are these children using the screen for? Social media, gaming.
Yeah, I think gaming is a major part.
Yeah. So what happens is that, yes, now in many instances, the use can become problematic because of the content. So again, they will need to be addressed differently.
So how should the parents take care of it if they feel the child is getting addicted? Number one, what is the symptom or what is the time?
So it's not the time. That's what I'm saying. How a screen has been introduced to a child, that decides.
Acha.
Things will not happen, just overnight like that.
Okay.
Second thing is, if the use is problematic. Again, I'm not talking in terms of the duration or what type of screen. Content. Content is the major issue. So when things are like this, then they will have to, be taken. You'll have to take a opinion, a consultation or an assessment for that, because this becomes one part of a major of many other things.
Understood. And doctor, what do you think about the parents stressing over good grades, about their kids, and probably, not understanding their bandwidth, but they are being pushed to get good grades? What would be your advice?
So whether somebody pushes for good grades or not, it will finally depend on the child.
But if the child is not able to take that pressure,
So that's okay. There'll be signs. There'll be difficulties.
again the same
Yes.
sign.
So what we are talking about is a situation
Yeah, a situation. Correct.
that may or may not lead to an illness. In a vulnerable child, it can trigger off an illness. In somebody who's not vulnerable, it will create a difficulty.
Okay. Understood.
So what happens is this, that I want my children to do well.
But there's constant pressure and
Yes.
comparisons happening.
Yes. So what happens is this, that what should we understand as parents? What should we understand? What I would like to understand as a parent is this. This is my child.
Yes.
First, is the child healthy and happy? Second, is the child average? Because average is important.
Absolutely.
Average is I'm going to be okay with anything, everything. I'll be able to deal with things. So I'm okay, average. Then there will be certain skills which are above average. You may be a good singer, I might be a good sports person, he or she may be a good, be very good in mathematics, above average. Now, what happens is, again, this kind of comparisons, if you look at the issue, is this child is doing this, so my child should also be doing this.
Exactly.
It is the problem with the way parents think. So, this is important. How does one communicate with their child? That seems to be the most important point. How do we communicate with our children?
Correct.
Do we communicate with the child as a person or as somebody who gets grades and performs? So that is an age-old thing, that when we say that, as the child grows older, you have to become more of a friend for your child.
Exactly.
So this is, by friends, what do you mean? That the child is comfortable in telling me
Sharing things.
everything,
Yeah.
pluses, minuses, likes,
Yes,
dislikes.
yes. Absolutely.
Because when, let's say after grade 10 or grade 12, and in this process it becomes very clear what the child himself or herself is interested in. And even at school, there will be teachers and counselors who will be on the same plane. Parents also come to this realization, which is a fair thing, because with trial and error and experimentation, you are at least healthy. But I would wish that parents would take more time. They need to understand what is happening with the child, and when they understand this, lot of things will fall in place.
Yeah.
So now, let's say we have parents who are understanding, who are willing to. I'm not talking of quality time. There's no concept of quality time. Time. Time doing something which is meaningful.
Understood.
So when parents interact with their children, they know what is happening with the children. There are a lot of things which can fall in place. One is the use of screens. If I like talking to my parents, if they're interested in what I'm doing, we have a nice chat. Okay, the time goes in chatting, less on screens.
Right.
If I get to know, if I understand that parents are supportive, they're willing to discuss with me, I am free to talk to them about my likes, dislikes.
Correct. Very important.
Parents feel that it is okay as long as my child is happy doing this, which is something that the child is able to do better, gives them, makes them happy, they would like to continue doing. That's a good thing.
Good thing.
So what happens is that when we look at things in isolation, they seem quite problematic.
Understood.
So one example was, I had a child, a patient who was about 7 years old. So
Okay.
6 years old, in first grade, and the child had a problem of bedwetting.
Okay.
Usually bedwetting will stop by 3 or 4 latest. 5 is the outermost limit. But 6 and beyond is something is not okay.
Okay.
So I had talked to the child, and I asked the child, okay, what do you do throughout the day? And the child gave me a whole routine.
Yeah.
School in the morning, comes home, tuition classes for first grader, then goes to some skating class, then goes to some phonetics class, then goes to some public speaking, something like that. So morning school, so the child gets up at 6:30, and the child's day ends at around 8. So I told the mother, see, this child has a busier routine than what I have. Are you sure that he or she, I mean, he is dealing with it properly? Yeah, he doesn't complain. Do you think it is necessary that your child is involved in so many things? Because the issue was this, that too many things, the child is not complaining, managing, but it is triggering anxiety.
Okay.
When this anxiety is getting triggered, this bedwetting is also getting triggered.
Right.
So yes, vulnerable child because the anxiety is coming up. But what is there in the environment? Right? So second question was, they were a nuclear family, so mother, father and child. So the mother had come with the child. So second question was, how does his father interact with him? Father hardly gets to interact with him. Why? Because father gets up late and comes home late at night. So when he comes, he has gone to sleep. And when he's awake, the child is in school. So they interact only on weekends.
Oh God.
So if the father would have come with the child, he would have no clue what is happening with the child.
Imagine.
So this is what happens.
It's wrong, right? I mean,
It is difficult, right or wrong, because this same thing would work very well for somebody, but not working for the child, obviously.
I mean, a father should not equally, but give time to the child as well.
That is
right?
that's what I'm saying. That is father's routine. This is the
No, but
child's
that
routine.
does affect, right? Their relationship, their mental health when it comes to a father-son relationship.
It will have an impact, but this is what happens.
Exactly.
What I'm trying to kind of put focus on is
Yeah.
how
I
busy our
understand.
children are.
Yeah. Some may have anxiety due to
Yeah. So
the busy
this kind of
schedule.
routines may work for for somebody, may not work for somebody. Now, who will be the best judge? Well, the parents have actually to be the first judge,
Absolutely.
not somebody who is not a family member or a doctor, because some things are just plain common sense.
True. Very true.
What would I do? I'll do two things: see if I can treat the anxiety and advise them. If I give some treatment for anxiety, it will work. Because anxiety, because of A, B, C, or not because of anything, will get better with some treatment for anxiety.
Right.
But what should the parents understand from this? That is a bigger challenge sometimes.
Also, what do you think about a childhood trauma that eventually impacts, the mental health of a person?
So trauma, one, is not something specific,
Okay.
and second thing, it is often a term which is not correctly used.
Okay.
So by trauma, if somebody means sexual abuse, a lot of physical abuse, emotional abuse, then it is maybe a correct usage. But if my mom shouted at me for something, if I did something wrong, or generally keep on telling me do this, that may not amount to trauma. So what kind of trauma is important? See, when parents are bringing up their child, sometimes some kind of disciplining will be needed.
Absolutely. Yeah.
By disciplining, I don't mean punishment. But children will have to be told to do this, not do something. Or parents are going to give, maybe yell at their children. Now, all that doesn't amount to trauma.
What about there are increasing rates in divorce cases happening between, a couple who are parents also. Does that lead to a trauma?
That can be, because what will happen is that there is going to be one a not a very healthy environment in the house, and it also can happen that the care that is given in the upbringing of the child will take a beating.
Exactly.
So when there is no love and caring in the upbringing, okay, it is a kind of, it not always, it can, because even sometimes divorcing parents who are in the process of divorce will be equally sensitive to the child's needs.
Absolutely.
But if not,
Yeah.
then there can be some kind of neglect, emotional neglect, physical neglect can happen, and the whole process is very stressful, which can act as a trauma. Yes.
Now we spoke about women, we spoke about kids. Let's also speak about men. You know, we always see our fathers, our brothers, everybody, undergoing a mental stress, whether it is, to support the family, to do something big in their careers. There's always a thing that I have a family to support. And there is a very common research, that has been happening, which says that the heart attack ratio is more in men when it comes to, compared to women. Now, what do you think contributes, to this kind of a stress that probably or not probably eventually leads to a heart attack?
Uh, if you look at heart attack, or what we would call as a myocardial infarction, it is not a, again, it is uh, it is not something that happens overnight.
Exactly.
So there is a whole process which actually starts from maybe early adolescence or even before that,
Okay.
which leads to the, uh, as we say, the atherosclerotic changes in the blood vessel supply of the heart.
Okay.
And there are many factors for that. But what is important is this, that in stressful situations, our body function is overactive. That can produce this kind of a myocardial infarct. But what it means is this, that even if there is no stress, but if you're running, you can still have that.
Okay.
Now, the point that you make is that why do men have more heart disease? Actually, women also have, but the hormonal functioning of women, at least till menopause, is kind of protective.
Okay.
So just by being a woman, because of the endocrine or the hormonal status, it has got a protective effect on heart function. So what happens is, when women have menopause and their hormonal levels come down, they have the same risk of heart disease as men.
Is it?
Yeah.
Then why is the ratio higher in men?
It depends on at what point, because throughout their lives, men have a different hormone composition function compared to women. So throughout their life, they have an increased risk. So let's say we take an age of 45. Let's say 50. So men will have an increased risk of heart disease right from day 1 till 50, age 50 years.
Okay.
But if a woman has got her menopause at 45, she has only 5 years of risk.
But in men, doesn't stress also play a very important
Stress is an
role, or is it-
integrative. Stress will always interact with our body systems.
Okay.
Stress doesn't cause anything magical.
Okay.
So, again, if I'll just take a few minutes on this. Stress is not a situation. Stress is how my body is reacting to external challenges.
Okay. So this is very commonly used, Doctor. Good, you mentioned about this. I'm stressed. I had a lot of work
Yeah.
today.
So again, that is the whole difference. So when people, so it's the same. It's an English word with different connotations.
Yes.
Stress would mean anything that is difficult to manage or handle. This would some this thing or something similar would be the meaning in any dictionary. But what it means to a human being in terms of body function, brain function is that there is this challenge or that challenge, but how my body is processing that challenge. Right? So when, again, I'll give you the example of running. We run, we climb stairs. So what happens? There is a stress on the body. This is a physical stress. Suppose we are on the fifth floor and the lift is not working. We have to climb the stairs. We may not be doing this on a daily basis. So climbing 5 stories is a physical stress. So what will happen? Our body will get more active.
Yeah.
Why? Because it has to meet up with the challenge.
Correct.
So our heart rate will be fast, we'll be breathing fast, we'll be perspiring, right? So once you're on the 5th floor, what happens? Challenge over. Sit, maybe have a glass of water, and within a few minutes we'll be back to normal.
Right.
So this was physical stress.
Understood.
The stress which we discuss, I am stressed, it is all psychological stress. Meaning what? These stressful situations are perceived, analyzed by the brain. And when the brain has to allocate resources that, okay, I have got more work. I have to, let's say, stay late at night, stay up late at night. Or I have this project which has to be done in 15 days. Okay. Or, I have to deal with this difficult person. What is that? It's, okay, different situations. But now the brain has to perceive, analyze, and formulate a response to that. Which will again be similar. Meaning what? Heart rate will be high.
Yeah.
Respiration will be high. I'll be sweating. Because I'm more active, I might not be sleeping properly or eating properly. Okay?
Understood, yeah.
So, whether it is physical stress or whether it is something like this, the body response is similarly decided. That is stress. So, I may be happy working long hours, no problem. But I may not be really happy dealing with difficult people. For somebody, it is just the duration of sitting long hours which makes them uncomfortable. So different situations, response is the same. So for us as doctors, we need to understand this response. Situations will keep on happening throughout our lives. Something or the other will keep on happening. But if this stress response is healthy, it will enable us to deal with the situation with minimum negative consequences.
Understood.
So I might lose sleep just for a day. But in somebody who's vulnerable, it may trigger an illness. So it is how this system works, decides stress.
Doctor, there's a, disorder, so-called disorder known as narcissistic personality disorder. There are others like obsessive compulsive disorder. These terms like OCD are used very commonly. Keep this properly, I have OCD. Do you think that particular, common use vis-a-vis the actual definition of OCD is absolutely different?
Yeah. So again, what happens is this, that these are English words. So people are free to use. Nobody has any copyright over any words. But they would not necessarily mean an illness.
Exactly.
Because one symptom or, one something doesn't define an illness. It is the whole pattern of things that are happening which will need to be evaluated to decide whether it's an illness or not. So definitely one thing, no. These are
And
patterns.
what about, narcissistic personality disorder? They think about themselves. How does that affect them and the others around them? What do you
So
think
if it is like this, so again, these are very, by personality disorders, what we understand is these
Yeah.
are complex patterns of behavior.
Okay.
And these patterns of behavior are not only complex, but they are lifelong.
Lifelong.
Yeah.
But they have a treatment or?
These behavior patterns are kind of fixed.
Huh.
These are lifelong. And they are seen everywhere. Means they are seen in all settings. Now, when something classifies, when something satisfies all these things, then we may think of a label of a personality disorder.
Okay.
If in our interaction I'm only thinking about myself, it is only selfishness.
Okay.
If I think I am the only right person, then it is narcissistic behavior, but not a personality disorder. Of course, there are treatments for behavior patterns, for whatever else is happening. But by definition, a person's personality structure is lifelong. Otherwise, we will be different people with the same name at different points in time. There will be no continuity.
You mentioned in the past about anxiety, which eventually leads to a panic attack sometimes. Can you, explain some signs of panic attack?
So, first of all, what is the experience of anxiety? The experience of anxiety is at two levels.
Okay.
One is at a physical level, and one is at a brain level. Of course, brain is a part of the body, so it is physical, but the symptoms are a different kind. So, the commonest symptoms are, if you look at the body, heart beats fast, breathing becomes fast, right? Some people will shake, shiver, shake, tremors. Some people will experience a sense of uneasiness in their tummies, butterflies, that kind of thing. Okay, these are common physical symptoms. Some people, when they're anxious, they get an urge to go to the loo.
Yeah.
Okay, physical symptoms. Symptoms which are more related to brain function is people will think a lot. They tell that their thoughts are racing, too many thoughts. They feel scared, they feel nervous, they feel restless. They are not able to focus. They are not able to sleep. They seem to be always thinking.
What should one do at this point in time?
So this is what is anxiety. Now, clinically, anxiety is experienced in different formats. Some people have this experience going on and on and on. Some people experience anxiety in packets. So this whole experience comes like a packet, very intense. Okay, very very distressing, but very short lasting. So people will come with this kind of anxiety attacks. Maybe some people have it many times in a day, but packets. So in between they are fine, or more or less fine. And some people will have one such attack once in a week, once in 2 weeks. So their experience is like that. Now that is called as a panic attack.
Okay.
So again, the rule is simple. I have to do something and I'm feeling very nervous. Okay, not an illness. Okay, very important event. I think I missed something. I feel too much of anxiety. Maybe a panic attack, but not an illness.
Okay.
So anxiety comes in various formats with various symptoms.
How would you? We mentioned about all of these, mental illnesses, mental health. Now, when it comes to mental illness, what is the cause of like diagnosis and the treatment? In brief, if you could explain, how would you diagnose it? And
The diagnosis is based on one, the clinical history. So I would get all the information about what is happening to the person in front of me. When did it start? How did it start? What he or she is experiencing? How it has progressed over time? Uh, so try and understand the pattern. Rule out other patterns. Uh, so one is the pattern of what the person is experiencing. Second is vulnerabilities. So vulnerabilities would mean one, previous episodes, family history, history of medical issues. I would also ask for history of substance use. Okay.
very, very important.
What is also important is this. In my clinical history taking, I try and also, if available, get history about, especially if it's a child, how was the period of pregnancy for the mother? Because we are not only talking of postpartum, but a lot of things can happen during the period of pregnancy also. A mother who has severe physical issues related to pregnancy, or if the mother is also experiencing psychiatric illness during pregnancy, by themselves they confer a lot of risk on the
Correct.
child who will be born.
Right.
So that is important. Developmental history, how the child has. Now, many of these things are not available. If somebody who's 50 years old and comes to me, difficult to get all this kind of a thing because
Yeah.
all those details may not be available. History of allergies.
Okay. That also plays an important
Yes,
role.
it doesn't play an important role, but it is a pointer.
Okay. Yeah. Right.
Because we talked about the stress system, how body processes stress.
Right. Right. Right.
If there is over functioning of this stress system, over processing, it can lead to changes in immune function also. So it can make me more prone to developing allergies. But also allergies to medicines, because some people have.
Yeah. Understood.
So history, I will do my assessment. I'll do a basic physical assessment. I may ask for investigations, but mostly the diagnosis is based on clinical history taking. In people who are elderly, definitely some kind of imaging, blood tests and all, because I would like to see what are the kind of brain changes that can be seen with aging. Brain changes may not be so much, or they may not be there when we are looking at children or adolescents. So imaging, blood tests, I'll arrive at a diagnosis. Now, after diagnosing, what is the point of diagnosing? The point of diagnosing is to understand what interventions would be necessary for this person. So, if the issues are very mild, if there are more difficulties rather than symptoms, then I might not start treatment. Medical treatment, that is, medicines or anything like that. But anything that is, been there for a long time, causing difficulties, definitely if it's a severe problem, then I would start my treatments. Usually, treatments are going to be long.
Okay. Must be different for different illnesses, right?
Different for different illnesses, but it will be case by case. But illnesses, psychiatric illnesses are very chronic, means they tend to run very long. There are very few people who have, kind of one episode and it is done.
Right.
Because this kind of things are very, as I said, integrated with everything that an individual does. So long-term treatment, definitely, many times lifelong.
Oh my God.
So treatments are there. Treatments are going to be in the long run. So treatment. where I would like to get a psychologist involved. As I said, one is when the problems are mild. Second is an individual who has an illness and lot of identifiable triggers.
Okay.
So two things are happening. One is the illness is there, and secondly, now this individual has to understand the importance of certain triggers in his or her life and see if that can be managed. So that inquiry into how I'm going to manage this situation, what I need to, there I'll get in a therapist. For children, there are a lot of behaviors which will need some kind of a behavioral intervention. Medicines are there,
Okay.
but certain behaviors need to be modified. That is where
Right.
I'll get someone. So, a proper mix of things
Understood.
needs to be decided. That is the importance of diagnosis.
Great, great.
So all there would be people who would say that, okay, I'll go to a counselor first. Well, severe problems may not get handled adequately there.
Right.
A proper diagnosis is, at least understanding of what is happening is necessary.
Absolutely. Your words of wisdom for the viewers.
So what I would say is this: one is that psychiatric illnesses are like any physical illness. They have to be picked up as early as possible. They have to be treated well. Treatment is going to be long term. So good treatment, adequate treatment will control symptoms, will not lead to fluctuations too many. And well, we all need to address our own issues related to stigma, whether it is the nature of the illness, whether it is related to what will the societal norms. Sometimes the stigma is there because there is a kind of a fear created that psychiatric medications cause a lot of side effects, they are bad. In fact, psychiatric drugs, medications are at par with any kind of medical treatment for any other type of illness. All medicines will have side effects. All medicines will work, varying from person to person. And this happens everywhere.
Nice.
So we need to address stigma. We also need to understand where we get our information from.
Very important. Yeah.
Any information that is related to health and well-being should be assessed to understand whether it comes from a reliable source.
Absolutely. Yeah.
And psychiatric illnesses, mental illnesses are a part of our life. So when we are when we are dealing with a family member, a friend, we need to understand that this is a person with a psychiatric illness and he or she is suffering from that.
Yeah.
These are not make-believe things, or these are not things that are done deliberately.
Very important. Very well addressed.
So this few things, if people have in mind, I believe that we can all work together to address psychiatric
Absolutely.
illnesses, to treat patients well, so that they can lead a good and healthy life.
Correct. And the world will be a better place if addressed. So thank you so much, Dr. Dave, for being here. It was such a pleasure knowing so much from you. You were an ocean of knowledge. Thank you so much for sharing your insights, which are valuable, and especially addressing to the audience that it should be taken seriously and should not be ignored. So thank you once again. Thank you so much for listening in today's episode of Bona-Fide Banter with Zalak Mehta. If there's one thing I would like you to carry with you, it's that asking for help is not weakness, it's care. for yourself and for your loved ones. If you found today's discussion meaningful, do like, share, and subscribe. And as always, stay tuned for more candid conversations, more insights, and more stories right here on Bona-Fide Banter. So until next time, this is Zalak Mehta signing off. Take care of yourself and more importantly, take care of your mind.